Hello and welcome. My name is Joseph Hawthorne and I am the owner of Block Fitness, a boutique small fitness studio here in Oro Valley, Arizona. Been doing this for 4 years now in this space and owned a gym in Southern California for another 7 years prior to that. Been a personal trainer for over 12 years. And I won't bore you with the lots of certifications as I'm a nerd and continue to love to take one after the next and thrive. So today we are going to be covering several different things. The first one is how to find a personal trainer and or a gym that is going to meet your needs. A place that understands the human body and the differences that you may be experiencing based on some of the health parameters that you're going through. A space that not only can modify to meet your needs where you're at, but also even work with your physical therapist if you are in the midst of some kind of treatment simultaneously to collaborate on a solution that is best to progress you as safely as possible. The second thing we're going to do is talk a little bit about not only core, but balance and some of the functions of the body so that you know what you can focus on, not only in your training sessions or when you're working out, but also just day to day, whether that's getting up from a chair, some things to think about. When you're walking places, some things to be aware of. And the last thing we're going to do is together, we're going to actually go through a workout here on this handy dandy little sheet. And I'm going to show you not only some opportunities of where to build strength and stability in those key areas for balance and for core, especially for that lower back and the stabilization of the spine, but also the regressions in case you may not feel like you're ready to do some standing exercises. So these are going to have the entire gamut and range to be able to modify to meet you hopefully exactly where you're at. All right, so part one. Let's talk about how to find a studio and or a personal trainer that is going to meet your needs. So the best bet is to ask for referrals. And if you have worked with a physical therapist in the past, that's where I would start. We personally have developed a relationship with several personal places that are local with other primary care physicians, just to make sure that we are a place where people can go when physical therapy may end and then they need real life to start to begin. We try and bridge that gap and be that place of that void. And so very often your physical therapist or a physical therapist that is in your area will have that same relationship. And if they're willing to trust a personal trainer, then I guarantee you there's something about that trainer or that facility that may be at a higher level than just a big box gym. There may be some great ones there as well. Now, if you don't have a physical therapist, ask your network, ask your friends, like who have you had from a physical therapy standpoint that you would recommend me talking to? Give them a call. Hey, who do you recommend in this area for a personal trainer, right? Second thing that I would do is really start to peruse their website and look for an understanding with words like strength training, strength therapy. These are going to be really key elements that you're going to want to focus on. Look to see that they have people that are in your age demographic from the pictures that they have and from the programs that they talk about. If they're all about intensity and no pain, no gain, I would definitely shy away. Now, maybe it's still worth having a conversation and asking, but inquire to what is their level of expertise with your needs. Ask by simply jumping on the phone and or stopping in and have those conversations. That's what we do simply with every person that comes in. The main thing that I would focus on once you start having those conversations is ask, do you offer some form of actual physical assessment first? If we do not assess where your body is at, I say if you're not assessing, you're guessing. So consider that if they're just like, sure, come on in, let's throw you into a group class. Oof, red flag for me. Or if they're like, yeah, come on in, we'll get started and let's sign up for this training package. If we don't know where your body is at, how are we supposed to know where we can take it? Because we all have different limitations. We all have different ranges of motion. And so just asking this simple question can help you determine whether you even want to step foot in such a facility before you waste your time or spend your time doing so. So first thing, ask your physical therapist, or if you don't have one, ask your network of friends who they've used in the past, and then make that connection with that physical therapist to say, hey, who do you recommend in the area? And then the second thing after you've done that will be to call that space, look through their website, see if there's people like you, see if they use words like strength training or strength therapy within their vocabulary. Look for signs of, do they focus on balance? Do they focus on functional core stability? These are very key common words of a place that's not just driven on come in and smash a workout and smash some weights, but that's truly going to be able to tailor it to you. Look for words like semi-private, where you know that it's a small group, as well as one-on-one to meet your needs where you're at, because we don't always want to just be put into a group and then not have the ability to slide out if you did need more help. They need to be able to offer all of those things. And then lastly, they definitely need to have an assessment protocol of some sort to walk you through. Now, our assessment looks at each joint and how it moves. We're gonna test the shoulder range of motion in many different capacities. We're gonna test the thoracic spine, your upper back. We're gonna see how the lower back moves to stabilize. We're gonna see what a squat looks like, but that's gonna be individual based on that person. If someone is coming in and they're using a walker or they're using some form of assistance, obviously that assessment is gonna then change to meet them where they're at, but it is a protocol so that we know where to begin. So that way, if we have someone who comes in and they're using quad canes post-stroke, whatever the situation may be, it's gonna be safe. And you want that to be specific to you, because even though you may be dealing with some similarities to several other people, especially within this group, you may have had a hip replacement that someone else didn't. You may have a rotator cuff tear that someone else doesn't. We're all built differently. Your training plan probably needs to be built differently, AKA specific to you, right? So hopefully you'll be able to find a place that is in your area, and then I would just go try it out. Give it a shot. Test, ask questions, evaluate from that aspect. See how you feel. The other thing to consider is once you go through, that some soreness and pain is ultimately inevitable. If that pain lasts longer than 24 hours, according to every research study that is out there, we know we've overdone something and something could be problematic. But if we see that pain start to subside within 24 hours, we are pushing within that normal threshold that is typically safe for our body. We have to go into pain a little bit sometimes with rehab. That's what happens within the world of physical therapy in order to get better. If you're just experiencing soreness or your muscles haven't done those things, then that's a really good thing. We also don't want to push so far that you can't get off the toilet, as I like to say. So finding that rhythm and that balance once you're in that space and continually asking questions. Communicate, communicate, communicate. All right, let's go into an actual workout that is specific to maintaining as much core stability as possible, which is really gonna help with balance for day-to-day functional activities. This is a workout you can do consistently 3 to 4 times a week if you wanted to. It can be tailored to as much or as little as you would like. And our whole focus with this one is teaching our body how to brace to stabilize and build that core so we don't experience a lot of the things that are happening within the back, right? So first thing we're gonna do is a wonderful warm-up. So I'm gonna set my little sheet down here. So that way it's slightly out of the way. What we wanna do with a warm-up is typically just get the body's heart rate up, get the body to a place where each of the joints are starting to feel like they have some movement capacity. And we also wanna make sure that our body is ready for the work that is going to come. Now, I would do a specific warm-up to the individual. So this is very much a blanket template one. So do take that into consideration, go where you're at. So the first exercise we're gonna do, if you can, is get down on the floor. I am gonna show you the modifiers if you can't, but we're gonna start with what's called a down dog, up dog. So we're gonna be in a yoga position that's like a plank, and we're gonna push the hips back as far as we can. And so this is really getting some shoulder mobility, hamstring stretches, and we're starting to loosen up that lower back, and then we drop the hips. And so we're teaching our hips how to flex and go back, and then how to extend and come forward. Now, this may be too much on the hands or too much on the back as of right now. So in that case, try doing that from the knees, where you're simply gonna push the hips back as far as you can, almost going into a child's pose, and then rocking forward and coming into that same cobra type position. Really good, because you're just gonna get the hips going back and forth. I want you to do 5 reps on that movement, but if that is still too much, be my guest. Use a wall to have your hands against the wall and push the hips back and come back on up. If you don't have a wall space, The back of a chair works really well also. So use whatever you have available to you. Exercise number 2 on our list that we're going with here is called a shoulder tut. So we really want to loosen up the shoulders, and we're going to incorporate some head movement. Now, the reason for this, I'm going to give you lots of reasons as to why we're doing things, and then you can just download the hopefully it's linked for you, workout. That way you can just go back in and just do the workout all at once. But I want to give you the explanations now. So these shoulder tuts, these are phenomenal for shoulder mobility, as we're going to almost be like a pharaoh where we're bringing ourselves all the way up and over, and you look towards that hand that goes under. And we're trying to get as much rotation of both as possible. We're also teaching our body that it's safe to side bend. And you may have noticed this if you've ever struggled with balance, or maybe you've known someone that has, especially as we age, we tend to not be able to turn our head while walking without stumbling. What this is doing, it's called vestibular activity. We are simultaneously teaching ourselves how to rotate, to refocus on something with our eyesight. And this will help eventually when we're in that walking motion to be able to turn the head without losing balance. We want to train it first in a static position. And so I want you to just go back and forth as far as it feels safe. If you feel clicking or pain, you stop always. Never going to work through pain. We work around pain. It's okay to feel on a 1 to 3 like, that's a little twingy. We don't want to push beyond that. All right, 5 reps each side. We're keeping it real simple. On to number 3. All right, so we're going to work into the hips. So we got a full body hinge on the ground. Now we did the shoulders. Now we're going into the hips. So we're going to do what's called a hip CAR. CAR stands for controlled articular rotation. It's not as fancy as you would think, where you actually get into a car. So a lot of times people are going to hold a wall, or they're going to hold the back of a chair on this one. So I do recommend that. You want to have some stability here instead of just trying to rely completely on balance. So once you're holding on to something, you're going to lift a leg as high as you can. Now, what's crucial is that we don't use the lower back. And this is great because we're going to strengthen the hip flexors. We're going to come up to parallel here and get it as high as you can until you feel like you're going to start leaning back. You should feel the opposite glute engage to stabilize you. Then we're going to twist this heel out as far as we can and come around like we're bringing our knee up over something, like you're going over a hurdle. So we're just going to work on this aspect. There's more to this move if you wanted to explore it, but I just want you to get in the habit of trying to open up the hips. Without hip mobility, we tend to use our lumbar spine to stabilize and use more from the back than from our glutes. If we don't have that hip mobility, we tend to find mobility from something else. Oftentimes, if we don't have the hip mobility, we even affect the knees. So just up, twist to get some internal rotation all the way around. Now the key, you're going to go 5 on each side, is to not lean and compensate. Because we're like, I'm doing great. Are we? We're cheating in some way here. And we're going to hit both sides, right? Now if that is too much, you can sit down, scoot right to the edge of your chair. I want you to lift as high as you can, and I want you to come over and then bring it back. Lift, twist, come over, and then bring it back. And you can stabilize with your hands, again, on that chair, all right? One more here for our last bit of our warm-up. It's gonna be our lateral leg raise. So with our lateral leg raise, again, I like to hold from the back of a chair, but now we really wanna turn on glute med, one of the biggest stabilizers of your body for balance, but also it's gonna really help with your core as it's part of your trunk. Your diaphragm, your trunk, your core, I want you to think of it like a balloon, right? A balloon expands to fill out the belly, expands to fill out the back, expands to fill out the sides, but also pushes up to control upward, pushes down to control your pelvic floor, right? And so we need to be strong and stable through this entire element, which means our hips need to be strong and ready to support us. So that's where we're gonna work the glute med, that big part of the side part of your butt, your side butt. And we're just gonna hold on to a chair. We're gonna kick straight out to the side. You remember Jane Fonda back in the day? She still knows what she's doing, right? She was onto something here. So I just want you to think extending straight on out to the side, going for 5 on each, but making sure, again, you're not getting that lean. Being like, Joseph, I'm doing such a good job. Right. So we want to try and just stay vertical as possible as we're going there. Again, if you need to be seated, that's absolutely fine. Go from here, try and sit back into your chair, and now kick straight out. So you're still activating here I don't want you to have your back against something because now we're not gonna actually get as much from the actual hip. We are just gonna be moving the leg, right? We wanna get more of that muscle activation to get us warmed up, all right? So that is our warm up. So 5 reps on everything. Again, just go through the PDF or the attachment, and that should make it a little easier. And then we're gonna get into the warm up. The actual workout. So with the actual workout, what we're trying to do is superset 2 exercises. We're gonna do this for a couple of reasons, and here's what that means. It means we're gonna have 2 exercises, and we're gonna do exercise A, exercise B, then back to exercise A, then finish off with B, and then if you're really up for it, you do it a 3rd time, A again, B a 3rd time again. And the beauty with this is that you're letting one other element of your body rest while you're working another one. So we're getting really good metabolic efficiency. So the heart rate gets up a little bit more. We're burning more calories this way. We're letting something rest, and we're not just sitting there or getting distracted by something as we're going, and we're making use of our time. So exercise number 1 with this is we're gonna really try and do a squat. Now, the squat can also be done with a chair. I'm gonna show you these modifiers. But one of the biggest basis support exercises you can do is a squat, because no matter what, you got to get down and up off a chair, off a toilet, into a car. It's a primary function. So even if you're like, but my back can't handle it, my knees can't handle it, I'll show you the ways that we can do this. So we want typically to flare our toes a little bit as we're going here. You can weight this up. If you've got a kettlebell or a dumbbell at home or a medicine ball, feel free, or anything heavy purse, whatever it may be. But we're gonna try and imagine like we're sitting down onto something. Now I challenge you to flare out a little bit. And the main reason, I want you to actually hit your inside thighs just as much as I want you to hit your quads and your glutes, right? The reason being is that a big part of the stabilization that we have in our body when we are in motion, especially when we're walking, is coming from our inside thigh to stabilize the leg. And that's one thing I feel like we miss as we age, or once we become fearful of hurting ourselves in some way. And that's where the shuffle tends to happen. Well, when we're shuffling, and you've seen that, if we catch anything, we're going down. And we've lost all strength through the adductors, your inside thigh, if you are in that shuffle position. They don't engage to the degree that you are when you're in a walking stance. We want to therefore spread into a little bit wider stance for this purpose and get a little bit more inside thigh. I want you to try and go for 3 sets, superset of 12 reps. But if you need to do 8, do 8. So you're going to see on your sheet there, it's got a range. It'll say 8 to 12. Do the reps that feel best to you. Now your aggression, nervous of falling, doesn't feel safe. You're going to go to a chair. You can fully sit down and drive back up. The key that I want you to focus on is don't let the knees come in. We want to try and keep out, again, when we're seated, to push that inside thigh to do some work, and a nice exhale as we're going on up. If that is still too much for you at this point in time, hey, that's all right. Let's stay seated and let's just do a march. Back and forth, back and forth. And at least this way we're getting the hip flexors and we're getting some quad to build up. Once you can do some marches for a while, I want you to march and extend and then back down. March and extend and then back down. We're getting even more of the quad, and then work towards come up and then come down. Come up and then come down. And then we'll work towards getting up more and more frequently and getting more range of motion, all right? So start with the level that you're at. Once you've done your 8 to 12 reps of whichever variation you're doing, great, we're going on to part 2. This is gonna be our calf raises. So you might think, oh, calf raises? That's a little bodybuilder-esque, right? I don't need to do some calf raises. But here's the thing. The calf is a huge stabilizer for your ability to walk, your ability for your foot to grab in. When we lose ankle mobility, we get that shuffle that we just talked about, right? Then we're gonna go down the moment our toe clips onto something. I'm trying to keep us up as much as possible. Yes, we're gonna get into more of the core training in a little bit here, but we gotta start with the big blocks, which is keeping us up on our feet as much as possible and giving us the ability to get up and down. And that's a crucial thing. That's where if we train some calves, we're good. So once you've done your squats, on the last one, stand all the way up, get behind your chair, and now I just want you to lift and really feel that squeeze. I want you to drive those toes into the ground, really squeeze those quads as you're going at the top here and squeeze the calves at the back here. So it's twofold. This is your wedge most of our muscles work as a wedge to create stability within that joint, right? And as we're coming up, once you get that squeeze, then relax back down. Now work towards getting as many reps as you can, and once you can do like at least 15, feel free to hold some weight as you're going. Again, let's regress this. Say we can't get up yet for whatever reason, that's okay. We want to, from here, place our hands directly on top of our knees and kind of push down. I like to go with my kind of fists in this position, but you can go hands as well. And I'm going to actively be pushing against my knees and lifting up my heels. I'm going to feel those calves still engage. If I want to get even more out of it, I lean into it. The more I push, the more that I'm forcing my body to resist because I don't have my body weight anymore to stabilize me. Then I'm going to go back to my squats. And I want you to try to work up to 3 sets. If 1 set is where you're starting, great. Again, I don't want you so sore. We can't move. So I want you to go back and forth with what works for you. All right, let's go on to superset number 2. So now we're going to go on to a little bit of upper body as we're going here. So what we're going to work with is hopefully a dumbbell. If you don't have a dumbbell, even a soup can would work. A band works really well also. We're going to try and do a 3-point row where we're going to stabilize through the trunk as much as possible. I recommend a chair, table, anything you've got that's got a stable surface where we can teach ourselves how to hinge over. We're going to support ourselves with one hand on the actual chair or the bench. I like to have my side that has the dumbbell, I like to have that foot back. And that's going to allow me to then have space to row. Now from this position, I'm pushing pretty hard into this chair, so I'm taking pressure off of my lower back so that my entire trunk has to stabilize me. This way I can just pull that weight directly on back and through and squeeze through my shoulder. One of the main reasons of this is that the moment we lose all pulling power, opening doors, opening things, then we're going to have to hinge over to do it, and we're going to have to twist our body. We have to twist our body, we're wrenching on the spine, and we tend to fall. So that if we can keep that strength within pulling exercise, we know that we're going to be able to keep much more vertical. It's better for the posture in all the ways, shapes, and forms. If you need to make it so that it's a little less pressure on the back, just make sure you're coming higher. Absolutely fine to be in a higher position if that serves you well. I want you to think chest up as you're going and exhale as you're pulling back. We're going to work towards, depending on your weight, a range between 8 to 12, again, to keep it really simple on each side. Because if you've got something heavy, 8 may be plenty. But if you've got something really light, you may need to go upwards of 12 plus reps. And that's okay. Tailor it to you with where you're at. All right? Part 2 of this one, we're going to do an overhead press as long as you don't have any kind of shoulder issues that are happening. Now, I want to challenge you, if you can, for balance and for core stability, we're going to try and do that same position where we had one foot back and the foot that was back had the dumbbell. So from here, we're going to press straight on up. Now, you might be able to even do this just with your arm, and that's great, right? We don't have to actually use a weight here. With this split stance, I'm fighting a lot of balance and stability. And then when I put a weight further up high, right, it's becoming more distal. So it's taking my center of gravity and transferring it into a much more unstable position, which makes this much harder for my core to stabilize. So I'm getting a lot out of this, not just from shoulder. So it's twofold. Now, if your body's not ready for that, that's okay. Just go with your feet parallel. We'll be more stable and we'll work from that position. If the shoulder can't go overhead, I want you to try and be in that unstable position and just do a curl instead. Most of us are usually okay with the bicep. We may not always have the shoulders to be able to come up overhead. You can also do it just body weight, again, without any kind of dumbbell. Now, if you're someone who's going to be in a chair, absolutely fine. Just do me a favor and try and come up off the chair as much as you can so that when we are doing that press, at least we're using our trunk to stabilize us. We're getting a lot of core stability again here, as opposed to sitting back, and we don't require any trunk stability to actually help us in this position, right? All right, so we've got our press, we've got our row. I would love for you to try and work up to, again, 3 sets. We're going back and forth between those 2 exercises and have the range between 8 to 12 reps on all of them. All right, let's go on to our last one, our 3rd superset. So with this one, we're gonna get 2 things. We're gonna get some core with what I call a pull-off press. Now, it does require a band and somewhere for you to attach it. So I know that can be challenging. Oftentimes people can just take this and wrap it around a door handle, which works really well if you're at home with this. I do sometimes recommend, depending on your doors, you may want to put it on the back side of a door that closes inward. So you're actually just pulling the door against the door frame itself so it doesn't come snapping off at you. That would be the last thing you would want. So with this, you're really going to be targeting the obliques, right? Let me explain real quick the way that the pelvis creates stability. And this is for anybody that has any degeneration that's happening within the back or within the hips as well. So when you're looking at your pelvis, it is like a suspension bridge. So you know when you're looking at a suspension bridge, like you can even think of, that big orange one in San Francisco, right? The Golden Gate. And you've got this main tower where the main structure goes all the way down into the ocean, all those wonderful things. But the bridge itself is held up by these suspension straps that come all the way down to hold up the entire bridge. Your pelvis may be that main center point, but we've got attached to it these suspension straps that are called our obliques that really hold us and lock us in on the sides. Well, counter to that is the inside thigh, your suspension that comes all the way up on in, including your hip flexors, your psoas that comes all the way up into your trunk, even attaching to your spine, are going to be from here on in, and you're going to be then the outside, the inside. And it's this counter that stabilizes and moves your pelvis. So we want to try and create as much strength from the inside thigh and as much strength here. That's going to decrease pain, reciprocal pain that we feel because of the instability that's happening there, but it's also going to drastically increase our stability as we are going. So 2 for 1, right? We already did the inside thigh ones with your squat. Now we're going to go on to the obliques with your core training, but it's still a safe way without having to get down and on the floor. So with that band attached to your door or to a pole, any band will work. Amazon can be your friend in this case if you need to. Step out as far as you can control and have your arms out. Now instantly, because I'm just holding on, inside hand is holding on, other hand is wrapped around, I am feeling all this core that is happening as it wants to pull and rotate me towards the pole. If I want to make this harder, I step out even further or I use a heavier band. But I'm keeping my arms locked out in front of me. And now I'm building this position so it doesn't let my body rotate towards. I'm fighting the rotation. So I'm getting anti-rotation training of my trunk. When you think about this, you're holding something and it wants to pull you over like a suitcase, right? Like you're taking something off of a shelf at a grocery store. We need to still have this trunk stability from this aspect. We want to train both sides. And I recommend with this, going for time. I love holding for 30 seconds. It's mindless, it's simple. I'm going to hold for 30 seconds, bracing and breathing normally as I go, and then switching and hitting the other side, right? Now you can also do this from a seated position. So once you do have this set up, you absolutely can hold here and still you're really going to feel this on that inside oblique to fight your body from having any type of rotation, which is great. Part 2 of this one for your core stability is going to now be, instead of fighting the resistance to rotate, we want to create our body's ability to rotate. And we're going to have a dumbbell or some kind of small weight, and we're going to chop. So we're going to come down to the hip, we're going to rotate up to the shoulder, come down to the hip, come up to the shoulder. So I'm rotating and using my body's ability to create force and then control that force into deceleration. One of the things that happens to us when we lose core strength and as we age is we lose this aspect of power, which is losing the ability to decelerate. So you think about it, when someone goes and they're older and they trip, it's the inability to catch themselves, which is a form of power deceleration training that causes in the fall, which leads to the broken hip, which leads to potentially worse. And so we want to still train the body's ability to rotate as much as possible and controlling that deceleration. The weight will come down and you've got to control it. So I want you to inhale as the weight comes down to your side pocket. Exhale as you swing it up over the other shoulder, right? So if your ears hang low, wobble to and throw them over your shoulder, like a continental soldier. I know you all know this. So that's what we want to do here. Any kind of a ball, any kind of a weight would work really well. And once again, the beauty with this, you're still gonna get plenty. All right, and then the last exercise that I want you to practice at any point in time, everywhere that you go, I really want you to practice walking by actually rolling through the feet and creating that stability. So you'll notice that the moment you lift a leg, all that balance and core wants to disappear. And so I want you to be aware as you're walking, am I rolling through my feet? Am I just not thinking about it and trying to turn it into this shuffle that's starting to happen because I'm worried about my core stability or worried about falling? Am I flaring the feet as I walk and hanging on my lower back? Start to be aware of where is what's called my gait cycle and where am I going. If you're gonna practice this down the hallway at home, what can work really well is create tight fists, proud chest, roll and march, and then if you can, look to one side, keep going, turn, look to the other side. And what that's gonna do is help with that vestibular control, lots of trunk control, as well as giving you the ankle mobility. And then we know we are preventing the body's ability to not be able to rotate, to have vestibular or control issues where everything gets dizzy and we tip, to have a trunk that is stable enough to support us, to have the hip flexors to be able to lift, to have the glutes to be able to stabilize when one foot is up, to have the inside thigh to stabilize, to keep us from tipping over the other direction when we're on that one foot, and the ankle mobility to keep us going. So this is how we're gonna check all of those boxes that we possibly can as much as possible to keep us as healthy as possible during any kind of back degenerational issue.